My name is Dr. Calliope. I'd love to just get started if you don't mind. Excellent. So we are going to start with the stethoscope and the sphygmomanometer. I'm just going to pop this in. And if I could just see your right arm here. Okay, we are going to just put your arm into this cuff, this little sleeve here. Get that nice and tight. And I have a little dial here that has a convenient clip. And we are going to attach it to the cuff. Bit of a juggling act of this. And I'm going to put the diaphragm of my stethoscope right in the crook of your elbow. Lastly, we have our little bulb that inflates the cuff. Let's just make sure this is closed. So if I give it a couple test bits there. Okay, that's open. And this is closed. Right. If I could have you just stay still, let your arm relax. Get this squared away. It's actually one of my least favorite parts about going to the doctor myself. So we're going to make it real quick. Okay. Let the air out of the cuff a bit. There we go. Let that go fully out. We'll just do it one more time. Okay? One more time. How you doing today? I hope by the time you leave my office you feel even just the littlest bit better. And a little bit out. And there's our diastolic. There we go. Let that go. Now, the juggling act continues. So let's take the dial off. And if you could just pull your arm out here. There we go. Now, just going to set that to the side. And then I can hear again. There we go. So let's just jot that down. So we had millimeters of mercury. And let's go ahead and grab your temperature. And while we're doing that, I'll grab your heart rate. So I'm going to have you give me your left wrist, and I'm going to have you also open your mouth, and we'll put this under your tongue, all right? Click that on. So just put that right there and lay your tongue on top of it. With the other hand, I'm just going to do our pulse here. Good. And there we go. Very good. Lickety split. So 4 degrees Fahrenheit with a nice even 72 beats per minute, and respirations are also within normal limits. So there we go. And I would like to just take a little feel real quick of your upper extremities, and we'll look at the capillary refill on your nails. So I'm going to put the backs of my hands just along your arms. Make sure nothing is too cold, too warm. The skin is dry. Okay, and then I'm just going to press and release on your fingertips. Press, release, press. Good. All right. So color is returning after less than 2 seconds. Excellent. Let's take a look at your face and your head. I'm just going to take a quick peek. Make sure the eyes are symmetrical, the nose, the mouth here, ears, the eyebrows, the cheeks here. Everything looks fairly symmetrical, fairly proportional. At least within normal limits, right? Go. Good. Let's go ahead and take a little look at your head. I'm going to do a bit of palpation here. Is any of this painful or tender at all? Okay. Let me know if it is. Good. And I'm just going to take a quick feel of your hair. And make sure that the hair is strong and that we're not losing a whole lot of it. Good. Okay, looks good. So I'm going to have you just look at my nose right here, and I'm going to kind of crowd around you, but it's for a purpose. So look at my nose here. Tell me when you see my fingers come into view. Okay, tell me when they come into view. Okay, which one's wiggling? Good, both. Tell me when they come into view. Good, which one's wiggling? Okay, tell me when it comes into view. Good, which one's wiggling? Last one. Tell me when my fingers come into view. Good, and which one's wiggling? None of them. Good. So, peripheral vision. Good. So, let's check for any drooping in the eye. Let's look at the sclerae. Look at the conjunctival tissues. So, you could just look straight at me here. Okay. The eyes. No signs of ptosis, and sclerae are clear. Irises clear. Pupils equal and round. We'll look at that a little bit more later. So I'm going to have you look up at the ceiling. Go ahead and take a look, and I'm just going to look at the eyelids. Good. Good, okay. Go ahead and look right here. Good. Okay, look up at the ceiling. Good, okay, look back at me. Just jot that down. are going to bring in the light. And I'm going to have you keep looking at my nose here. I'm going to bring in the light from the side, so we're going to bring it right here. Okay, and here. Good. And again, bring it to the side, at a diagonal. Okay, coming from behind you. There. And there. Good. Other side, so just keep looking straight ahead. Bring the light right there. Okay. And straight on. So far, pupils are equal, round, reactive to the light. Okay. Right at the side. And then at a diagonal. There we go. Good. One last time. Just at the side there. Diagonal. And keep looking right here. Good. So, corneal light reflex looks equal on both sides here. Just making sure. And your pupils are also reacting correctly. So I'm going to put my hand right in front of your eyes. We're going to look the direct consensual response here. Direct. Good. Consensual. All right. Consensual. Direct. There we go. Good. And direct. Direct. Consensual. Consensual. Good. Direct. Consensual. Consensual. And direct. There we go. Direct consensual response test. We are going to bring in a different object for you to focus on. I have this little white tipped tool here. I'll have you look at this and then look at the light behind me. Good. Look at this. Look at one of the pink flowers behind me. Look right back here. Look at the green wall on this side. Right back here. And if you could look at the orange flower painting, the orchid. Right back here. Good. Keep your eyes focused here. I'm going to bring it in real close. And we're going to try to get your eyes to cross. So we'll just come in. Okay, back out. In. Good. Back out. In. There we go. Very good. If I could have you just follow the tip as we go to the side, up, down. Just keep following this without moving your head at all. Good. We're going to test the cardinal directions of gaze. Do your best to follow it. If it goes a little bit out of view, okay, let's go up, down, up, down. Good. Side, side. There we go. Okay. Good, good. Let's just do that one more time. There we go. And can you follow this in and out? In and out. In and out. Good. Other side right here. Follow this. In. Good. And in. And out. And in. And out. Good. Put that down. I am going to have you look at the wall behind me on this side. I'm going to get my ophthalmoscope out. We're just going to take a little look at the eye. I'm going to put my hand right on your head so I don't run into you. So just keep looking at the wall. And I'm going to take a peek at the back of your eye with this. So with this tool, we're able to see the optic disc, the blood vessels, the macula. Okay. Just keep looking at that wall. There we go. There. Okay. And if you could just look right into the light here. Good. Good. Okay. If you could look at the wall behind me on the other side. Good. And just going to closer here. Keep looking at the wall behind me. There you go. Okay, so just looking at the optic nerve there and the blood vessel. Okay. Can you look right into the light here? Good. Good. Okay. Let's move on to your hearing. I am going to go behind you. We're going to do a little whisper test, right? Okay, I'll be right back. Okay, we just want to make sure that you can't tell which side that I am speaking on. So if you could just repeat the word red, yellow, green, orange, chartreuse, pink, brown, black. Good. 1, 2, 3, 5, 8, 13, 10, 9, 7, 5, 3, 1. Cow, chicken, aardvark, platypus, manatee, ox, groundhog, deer, coyote, wolf. When I come back around, I'm just going to take a look at your ears before we bring in the otoscope. Do you have any difficulty with hearing any of those words when I was behind you? Okay. Was it fairly easy to distinguish right from left? Okay. Let's switch out the ophthalmoscope head for the otoscope. we'll need a speculum. There we go, all locked in. And do you mind which ear I look at first? Okay, so I'm just going to come out right here, and we are going to kind of gently insert the otoscope. Take a little look inside the ear. Is this painful at all? Okay, good. Do let me know if it is. And look at the ear canal, the tympanic membrane. Make sure we can see all our landmarks. Okay, that all looks good. Everybody looks healthy and normal, so we're just going to go out, and then we'll take a peek at your other ear here. Look right here. Take a look around. Just do a little look around. Ear canal. Tympanic membrane. A couple landmarks. Good. Any pain with this ear at all? Okay, good. Looks like you've got a good couple of ears here. Hearing's intact. And everything looks good internally as well as externally. Everything looks good there too. There we go. We're going to switch speculums. I need a different one because we're going to look at your nose. Let's see. Let's get one that's a little thinner here. There we go. We'll get that in a minute, so I'm just going to look at your nose here. If you had any issues with breathing, with runny nose, nosebleeds, dry nose, snoring, anything like that. Okay, good. So, you could just tip your head back. Look inside. Have you take a breath in and hold so I can have a good look. Just take a breath in. Hold. There we go. Good. Got the turbinates and the nasal passage. Okay, exhale. Breath in. And hold. Good. Alright. There we go. Looks good. Okay. All the tissues look good. Go ahead and breathe out. Now I'm going to occlude one of your nasal passages, and we're just going to have you take a couple breaths. Breath in and out. In, out. Good. Other side. Breath in, out. Breath in and out. Okay, good. So, did you feel like there was any trouble with any of that? Okay, good. Let's go ahead and do a little bit of percussion on the sinuses. Just let me know if you feel any pain or tenderness with this. It's about that season. Sinus infections abound, pressure, congestion, all the bits and bobs. Any pain or tenderness with any of this? Okay. Very good. We're going to get our light back out, and we're going to look at your mouth. We're going to look at your lips to start. Just make sure that the color's correct. Texture. If you could open your mouth, I just want to look at the corners here. Very good. And keep your mouth open. We're going to look at the buccal mucosa and the gums, the teeth. Okay. Very good. And if you could stick your tongue out. Good. We're just going to look at the pharynx wall there. If I could just have you say ah for me. Okay. Good. Alright, so I'm going to have you keep your tongue sticking out. And we're going to just check the tongue movement. Make sure the hypoglossal nerve is intact. So if I could have you move your tongue this way, up, and down. Okay, very good. Put your tongue back in your mouth. Let's go ahead and take a peek at your lymph nodes. I am going to be just coming right back here. And we'll get the occipital nodes first. The post-auricular, pre-auricular, submental, submandibular, under the jaw, and anterior cervical, posterior cervical, deep cervical chain, and supraclavicular here. Okay, excellent. Now I'd like to make sure that your head movement is all right. So if I could just have you follow some instructions. If you could just turn your head to one side, the other, all the way up, all the way down. And can you tilt your head to one side, trying to touch your ear to your shoulder, and the other side. Good. Give your shoulders a couple shrugs for me. Okay, good. Bilateral and That looks good. So, cranial nerve 11, the accessory nerve is intact. I'm gonna have to switch our side paper here. Not quite done, but running out of room on the front side. So let's go ahead and look at the trachea. So this might be a little uncomfortable. It's not very fun if someone is pressing in on your neck. So I'm going to look at the windpipe here. We're also going to look at your thyroid. So I'm just going to come in here and make sure the trachea is midline. And then if I could have you just take a dry swallow for me for the thyroid. Just like that. Okay. There we go. Good. Now we are going to be looking at your posterior chest wall or your back. So if I could just have you turn around, and we're going to do a few different tests here. Get out the stethoscope. Okay. There we go. Now I just want to check real quick on your back. I want to look at the spine. Okay, good. And if I could just have you bend forward. Right, sides look equal. And if you could very, very slowly come back up, vertebra by vertebra. Right. And I'm going to go ahead and check your chest expansion real quick while I'm here. I'll be putting my hands on your back. And as you take a breath in, my thumbs should pull apart. And as you exhale, come back together. So we want to make sure that maybe one side isn't going more than the other. We want to make sure that there is expansion and retraction. So I'm just going to put my hands right around your back. It's going to be a little tight. If I could have you take a deep breath in and out. Deep breath in and out. Good. So let's bring the stethoscope in. As I place the diaphragm on your back, I would like it if you would just say the word 99. 99. Good. 99. 99. 99, 99, 99, 99. Good. I'm going to listen on the sides here. 99, 99, 99. We're going to do another resonance test. So that was the vocal resonance. Now we are going to do some percussion. So I'm going to be tapping along your back. In both instances, we're listening for how the travels in your chest, whether it is resonant, hyperresonant, dull, or has a stony dullness. Good. Naturally, the sound generally gets lower the lower we go. Good. On the side here. go ahead and do our auscultation. This is where I have you breathe in, breathe out. If I could have you take a deep breath in and out. Breathe in and out. Breathe in and out. Breathe in and out. Breathe in and out. Out. Okay, last one on this side. Breathe in and out. And then the other side here. Breathe in and out. Breathe in and out. There we go. So while you're here with your back to me, I'm just going to check for any sacral edema real quick. Feel if there's any swelling here. Good. All right. So if I could have you turn back around, we will repeat a lot of that on the anterior chest wall. Okay. So we're going to start with vocal resonance. If I could have you say 99, 99, 99, 99, 99. Some percussion. There we go. Now, go ahead and listen to the lungs from the front. Deep breath in and out. Deep breath in and out. Deep breath in. Last row. Deep breath in and out. Deep breath in and out. Okay. So, real quick, we're going to do some palpation around the heart. So, what I'm going to be feeling for with the flats of my fingers and the heel of my hand are heaves and thrills. These are palpable heart murmurs. Now, heel of my hand here, and then we'll take a listen to the heart. Start at the aortic valve breathe normally here. Pulmonary. Tricuspid. Mitral. Good. And for the apex beat, so I'm just going to come here at the midclavicular line, and then along the sternum we have 5th intercostal space, right about there. Okay, good. That's where the apex beat should be, and that's where it is. I am going to be doing a little work with the neck here. We're going to take a listen to the carotid artery and doing some palpation. So, might be a little uncomfortable. Again, this one's much quicker than the trachea. So, just take a deep breath in and hold. Okay, exhale. Deep breath in. Hold. Exhale. I want to make sure there weren't any bruits or audible heart murmurs before I try to palpate the artery. So I'm just going to take 2 fingers, place them lightly here, and breathe normally here. Good, another side. Excellent. So let's go ahead and take a listen to your abdomen, and then we won't need the stethoscope for the rest of the exam. So, breathe normally here. I'm just going to move around fairly quickly, a lot quicker than doing the lungs. Good. We'll do some percussion, map out the organs, some palpation. Good. Very good. Let's go ahead and just put this down. Our percussion here. We are mapping out our organs, making sure everything sounds correct. Good. Now, I'm going to take a little feel around here. Let me know if any of this is painful or tender. Okay. Good. Now, this is going to be a little uncomfortable here, but we're going to be mapping out the liver and the spleen and the kidneys, see if they're palpable. So first, I'm going to have you turn your head to the side, and I'm going to push on your liver. So that's going to be right here. And as I do that, I'm going to watch what's called the jugular venous pressure. So, is this painful as I'm pressing in here? Okay, I'm going to press quite firm. So we'll go in. I'm just going to watch the neck here. And release. Okay. All right, you can go ahead and just put your head back. I'm going to have you take a deep breath in and out. Let's feel around the liver here. Okay. deep breath in and out. Then we have the spleen. Okay, last one, kidneys here. See if these are palpable. And deep breath in and out. There we go. Don't want to punch the air out of you. And make sure there isn't any air in here. Okay, there we go. Just gonna take some notes real quick. Make sure that's Now I am going to look at your upper and lower extremities. So first I'm just going to press on the joints. Let me know if there's any pain or tenderness. So we have the shoulders here, the elbows, the wrists, and I'm just going to squeeze the hands as well as each joint. Any of this painful or tender? I wouldn't suspect so. Your joints weren't any warmer than the rest of you. And there hasn't been any stiffness. Good. Oh, that looks good. So I'm just going to take a little look at the skin. Make sure that's all clear. Good. Now I'm going to have you follow a few instructions for me. We're going to check your range of movement, a little bit of your strength. If I could have you close your fists, display your fingers open, make a tabletop, fold over the tops of your fingers and the whole fingers. Good. Can you bring your wrists in, out, up, down, roll them inwards and out. Good. And can you put your upper arms at your side and bring your lower arms in and out? So we have internal rotation, external rotation at the elbows. Okay, good. And can you bring your arms all the way up? All the way back? Have them start at your sides and come up at the side. Okay. Any of that painful at all? No, shoulders are good then. I'm going to have you bring up your arms like this. I'm going to push on your arms. I want you to resist me. Okay. I'm going to try to pull you towards me. I want you to resist me. Good. Now I'm going to try to push down on your shoulders, and I want you to resist me. Press up into my hands. Good. Okay. Let's go ahead and look at your lower extremities. So, we have the hips, the knees, we have the ankles, and I'm going to squeeze the feet and the little joints in the toes. How's all that? Okay. Let's take a look at the skin. Look for any abnormalities. Nothing is clammy. It's warm and dry. So, I'm going to have you bring your toes up and down. Good. And your feet up and down. Okay. Side to side. Good. Roll them in and out. Good. Kick out your legs at the knee. Okay. And if you could just take one leg and rotate it out at the hip, bring it back, rotate the other, bring it back. Good. Now I'm going to press your feet down. I want you to press up against me. Okay, I'm going to try to pull them up. I want you to press down. Okay, I'm going to try to press your shins forward. I want you to kick out. And I'm going to try to pull your calves towards me. And if you could just resist that. Good. I'm going to put my hands on top of your thighs. I'm going to press down, you press up. Okay, good. We have some good strength there. Lastly, let's get the Degerine hammer here, and we'll test some reflexes. If I could have you put your foot on top of my knee here, I'm going to hold the top of your foot, your toes, get a little bit of tension on the Achilles tendon. Then we are going to... Good. Other foot on my knee. Okay. Excellent. You can put your feet down and let your lower legs hang freely. Okay. Then we'll get the knee. Good. Now for the arms. Now you take your arm. Put your forearm on your thigh so that your hand hangs loosely between your legs. We're going to get the triceps and biceps reflex. Triceps back here, biceps right in here. I can have you just relax the arm, let it go loose and limp. Okay, I'm going to put my thumb in the crook of your elbow here. Okay, and switch to the other arm. Other arm hangs loosely between your legs. Forearm rests on top of your thigh. Triceps. Biceps. Good. So, deep tendon reflexes +2 across the board. And that is going to be the end of our examination. Do you have any questions for me at all? Okay, let me just turn this over. Just make sure we got everything. I'd like to thank you so much for coming in today for this examination. I hope you have a whale of a day and a good rest of your night. Thank you.